fervor to follow there. Thank you guys everybody for being here today. It's really nice to just look out and see all the people, a lot of people that I talk to weekly, and then just to see everybody in the same room. So just thank you so much for being here for us today. So I'm going to talk about a little bit about a couple of components of our clinical approach to treatment. So where all these come from, though, first, the origin of this, our values really come from Dr. Kopler and Dr. Salvatore. I was actually the second counselor that Victory ever hired, so I had the true privilege of not just working with them, but literally working alongside them. Like, Dr. Kopler and I have been in the room together treating patients and talking to patients together. So a lot of my own, clinical values, and also a big part of my job today is to remember those roots and those values and carry them throughout what we continue to do today. So the first one of those things is person-centeredness. And that's a word that people use a lot, but I'm going to tell you what it means to us. So person-centeredness to us means that when a patient walks through our doors, they're not just their diagnosis, and we do not just treat their substance use disorder or their mental health condition. The patients who walk through our doors are just like us. They are husbands and wives, they're mothers and fathers, they're brothers and sisters. They have hopes, they have dreams, they have fears, and we recognize all of that, and we really get to know our patients. And we work with our patients, yes, on their substance use disorder and their mental health condition, but we also talk to them about what are your other goals in your other life areas, and we work with them to achieve those things, because it's important to them. So that's what person-centeredness means to us. We see them as a whole person, not just their diagnosis. Then there's patient autonomy, or their ability to choose and their ability to make decisions. And we don't see ourselves as preachers, as people coming into treatment and we say, this is what you need and this is what you're getting from us. That's not how we operate. How we operate in all of our service lines is a patient comes in and we talk with them and we educate them on their options. These are your options for medication. These are your options for the types of therapy that we can do with you. We can give them suggestions, we can give them guidance, but at the end of the day, we truly believe that it's a shared decision-making process. And we want to know from the patient, what do you think is going to work for you? What do you think sounds good to you, something you want to do? Oh, you don't want to do that? That's okay. Here are your other options. So respecting patients' autonomy, their ability to make decisions for themselves, is really important to us. And I think what makes it so important too for patients in addiction, so for those of you in this room, like myself, who have struggled with the disease of addiction, one of the defining characteristics of being at the end of your road before you get sober is you've realized that you've lost all control of your life. You've lost all your control to make decisions. So this aspect of giving patients autonomy to make choices for themselves and educating them to do so is also highly, highly empowering, because now patients they're making choices for themselves, and they're making good choices for themselves. So that's a really beautiful thing. Then there's harm reduction. So I know harm reduction is a phrase that has a lot of buzz around it. And I think it's created a lot of like binary as well, like an us versus them in our society. But I want to talk about like what that actually looks like in practice for us. So harm reduction for us is not condoning substance use. That is not what harm reduction is to us. The absolute end goal of harm reduction is abstinence. But how we see it is we meet patients where they're at. So if a patient comes through our door and maybe they're in a pre-contemplation state of change and they're not ready to make changes yet, but they're showing up, we're okay with that. We meet the patient where they're at. Since everyone's giving quotes, so I love the phrase, I really do. I love the phrase that that people say, you can lead a horse to water, but you can't make it drink. But you can give it pretzels to make it thirsty. And I'm a big, big, big believer in that. And that's what I think harm reduction is, right? Harm reduction is saying, hey, we're going to take you as you are. We're going to love you as you are. We're going to engage you as you are. We're going to respect what your goals are at this point in time. But we're going to make you thirsty for recovery, right? And we're going to do that by engaging people. And, we have a lot of community partners in this room who, like, Paul, I'm going to shout you out here. We get patients in the outpatient setting who really need to go inpatient. They really need to go to detox, but they're just not ready yet, right? So we'll work with them for maybe sometimes, not exaggerating, up to a full year. And then I'll call Paul and I'll say, Paul, we've been working with this young lady for a year and she is finally ready to go inpatient. Awesome, right? So this way of practicing too, it's not easy. It can be challenging. It can test your patience, but it really does work, and we really do see the fruits of our labor in that regard. And then lastly, Moshe talked about community, building a community for our patients. But part of our clinical approach is also building a community of other providers around us. Everybody in this room is a partner to us. A lot of our patients are not just engaged with Victory, right? They're engaged with multiple partners in this room. So we are a system that truly, truly cares about each other. And it's important for our patients too, because we live in a world where, the system is also very complicated, right? So patients might not know, well, where can I go for this? Where can I go for that, right? So we kind of serve as the bridges and the navigators for that. And that could be the difference between somebody's life being saved or not as well. I'm going to shout out Allison LaMonica as well, and Kenneth Peters. Kenneth Peters was a very important part in my journey of sobriety. I did not get well there. I went to outpatient there. But Kenneth Peters and Claudia did my assessment when I first showed up. Kenneth Peters served as the bridge that got me to the Villa, where my journey really started, an inpatient that is now closed down, but in upstate New York. But I didn't know where to go to inpatient. I didn't know what to do, right? So Kenneth Peters served as the bridge for me to get somewhere where my journey really could begin, right? So, we all touch so many patients at the same exact time. And that's a really important part of our clinical approach to know too, that it's truly a village. We cannot do it alone, and we all need each other. So those are the things that are really important to us. Person-centeredness, autonomy, harm reduction, and being a bridge with everybody else in the community. So thank you guys so much for being here today. I'm excited to hang out and eat lunch with everybody after. Thank you.